very lucky to work on this project, which was looking at access to clinical trials at UCLH. We're a sizable clinical trials centre in London where we offer standard of care therapy, early phase clinical trials and late phase clinical trials. And we were looking at the cohort of patients that are coming into our services and seeing the distribution of the socioeconomic backgrounds as well as ethnicity to see whether there is a cohort of patients who are underrepresented, because ideally in clinical trials and indeed with standard of care therapy, you want good access to all cohorts of patients, irrespective of their background. So in our study, we looked at the patients who'd been through our service over the last 10 years and found that there was an underrepresentation of ethnic minorities, but also an underrepresentation of patients from lower socioeconomic groups. In regards to how we established areas of how we established patients from lower socioeconomic groups areas and areas of less social deprivation, we used the English indices of multiple deprivation and then compared it to the NCRAS data, which is the incidence of myeloma, which told us the incidence of myeloma across these different areas of deprivation. And interestingly, we found that unfortunately, patients from areas of high deprivations were very poorly represented, particularly in the early phase trials group, but also in the late phase trials group. And one of the things that we noticed early in the trials was that even our referrals, and as UCLH has quite a large geographical catchment area, you want to have good access to it for everybody. But we found that even our referrals coming in from the external centers were significantly more from areas of less deprivation than areas of more deprivation, which told us a bit that there were factors to be addressed at the local, at the patient's local areas as well. And then we looked further into the overall survival of these patients and found that in various groups, social deprivation has a significant impact on how well they do, even after they've had access to therapy. So patients of a white ethnic background from areas of high deprivations did worse than patients of white backgrounds from areas of low social deprivation. Patients who were older, so over 75 years old, did much worse if they were from an area of high social deprivation as opposed to low social deprivation. But we didn't see that in the younger patients. So it was a very interesting study that brought about these quite pertinent questions that I think we should look further into, see if there are factors that we can mitigate to improve access to care for these patients who are underrepresented and therefore improve their outcomes. But it was also important to recognize that certain groups of patients are underrepresented in clinical trials because for a good trial to be really fully informative, you want it to represent your whole cohort of patients adequately.